The RATIFY study was an attempt to see if targeting the FLT3-mutated tyrosine kinase along with chemotherapy might be a better way to treat AML patients who have such a mutation than standard chemotherapy. So the RATIFY study required screening of about 3,300 patients with AML to find 717 who had a FLT3 mutation of either of the two known subtypes, either an internal tandem duplication, which is an extra between 3 and 100 amino acids in the juxtamembrane region of the enzyme, or the less common mutation called a TKD, or point mutation, in the tyrosine kinase domain. Anyway, we found 717 patients with one of those two mutation subtypes who were enrolled on the trial. And the trial consisted of, in the standard arm, standard chemotherapy, Daunorubicin at 60 mg per meter squared per day for 3 days, plus Cytarabine for 7 days. They could get reinduction, then 4 cycles of high-dose Ara-C consolidation, then 12 months of maintenance with placebo. In the experimental arm, with each of the cycles, they got 50 milligrams of Midostaurin beginning on day 8 for 14 days. That would be during induction, reinduction if needed, and each of the 4 cycles of high-dose Ara-C plus 12 months of maintenance. And the primary endpoint of this trial was overall survival, unrestricted according to whether or not the patient had a transplant. The trial did meet its primary study endpoint by showing a statistically significant improvement in the likelihood of being alive or lack of dying if you were randomized to the Midostaurin arm. There was a 22% reduction in the risk of death for patients randomized to the Midostaurin arm. Those were the top-line results of the study.